Well, as you know, we are in the middle of an air quality alert, which has caused a major public health hazard.
The smoke is coming from wildfires in Canada, and we got to wondering, I'm sure as you have as well, how dangerous is the smoke? Tracey Holloway is a professor at the Nelson Institute for Environmental Studies, among other titles at UW-Madison. Welcome, Professor, to the show.
Thank you so much for having me.
So can you tell us, do we know what is in this smoke?
Yes. The smoke is a mix of gases, liquids, and solids that are released from forest fires, very much like if you're having a barbecue in your backyard. And some of them are called particles, and those are the ones that are the most damaging to human health because they penetrate into our lungs and are associated with respiratory disease. But there's other invisible gases, and especially one that we're concerned about for health are the ingredients that form ground level ozone. So that's sort of often called smog. So both the particles and the smog are kind of a double whammy for health.
We've seen a lot of smoke from fires before, but not like on ground level. That makes this one different.
Yeah, it's different for a few reasons. First of all, it's occurring much earlier in the season. We normally get a little bit of smoke from Canadian fires and other fires across North America occurring in July and August, but this is occurring much earlier. It's much bigger. These are some of the biggest fires in Canada in history. And the way that the winds are blowing, that they're coming and kind of parking the smoke right over Wisconsin.
So there are some people who are saying that, well, you could be in LA, you know, this is what they deal with all the time, but we're just not used to this. But we do really need to take some precautions. We just can't go along with everybody else.
Yeah, right. And, you know, this is not typical of LA today either. This might have been typical of Los Angeles back in the 1970s.
Correct.
This might be Bangladesh or something.
Right, yes. There certainly are parts of the world where this is not uncommon. But in the U.S., our air has been getting cleaner and cleaner since 1970. And as a result, we can see life expectancies are growing. I mean, there's so many benefits to having cleaner air, and that's why we've made it a priority in the U.S. So right now, these naturally occurring sources, they're not regulated by the EPA, and they're really setting us back in terms of our clean air.
Is this a danger to like animals that live outside or our pets?
You know, it's a great question. There's been very little research about how air pollution has affected animals. A graduate student and I did a study on how air pollution affected birds a few years ago, and we were really surprised that we didn't know more. So I think that's something that, you know, we see that birds are affected by air pollution, humans are affected, so I would imagine that our dogs and cats aren't happy either.
Do you think this is a red flag at all to anybody who might be studying the air pollution and whatnot?
Yeah, I think it definitely, I mean, there's a lot of us who have been studying air pollution for many years, and, you know, usually it's a good news story because overall our air has been getting cleaner and cleaner. And so it's really disappointing on days like today to walk outside and really face this immediate public health risk.
Is this a one-off or is this going to be occurring more and more?
I mean, already it's been occurring quite a bit over this summer season, and we're just at the beginning of the summer. So it's hard to tell what to expect through the rest of the summer and when we look at future years. But a big problem is that the temperatures are warmer, the land is drier, and for many decades, scientists have been predicting that wildfires and smoke would get worse. And we're seeing them getting worse as one of the consequences of climate change.
So the key is take care of yourself, take care of your people, your animals, and really guard yourself.
Yeah, I'd say guard yourself now, but also think about what can we do in the long term to minimize the risk for the future.
And if you're at risk, wear a mask outside right now.
Yeah, that can really make a difference, those N95 masks.
Thanks for being with us today. Very interesting.
Thank you so much.
Thank you.
Thanks, Tracey.
Thank you.